Apert syndrome. Apert syndrome is a genetic condition or disease that occurs when the joints in your newborn's skull closes too soon upon fetal development. Even though Apert syndrome has multiple medical awarenesses, some surgeries and therapy may improve the outcome and delay the long-term complications. Apert syndrome necessitates psychological and social support for an individual and their family to gear challenges and encourage resilience. Raising a child with Apert syndrome presents stress for families and parents. This causes a need for more financial assistance, more medical care, and some psychotherapy. It also helps to deal with the peer pressure and the difficulties of handling a parent with the disorder. Apert syndrome is inherited in a dominant pattern. The individual must inherit one copy of the gene to develop the disease. There's a mutated gene called FGFR2, fibroblast growth factor receptor 2. This is a gene that controls bone development and directs control of bones in the skull, hands, and feet. Some of the symptoms of the genetic disorder are rare. However, some physical symptoms may include hypertelorism. This is the bulging and widely spread of eyes. Syndactyly may occur. This is the fusion of fingers or toes. It also involves the thumb and the pinky. Other symptoms that may occur could be craniosynostosis. This is when the head is shaped abnormal and the skull is flat. Lastly, mid-face hypoplasia occurs. This is when the middle part of the face is underdeveloped and the nasal bridge is flat or beaked. As a result, other conditions may exist such as developmental delay. This is a slight intellectual disability. We think vision issues that are caused by eye abnormalities are due to Apert syndrome. Breathing difficulties also occur, which transpire from complications in the nasal or airway. Another is a loss of hearing when the ear may have a chronic infection. Then skin issues occur when acne is present or excessive swelling continues. Lastly is missing teeth or other dental problems. This genetic disorder is rare and requires a treatment plan. The estimated prevalence of individuals with Apert syndrome has ranged high. It has ranged from 1 in 65,000 to 1 in 160,000 live births. Basically, 15 out of every million babies are born with the syndrome. It was significantly proven that males and females are both affected equally. Lastly, the risk of having a baby with Apert syndrome is slightly higher in older males. The age is usually ranging around 40 years old. Most children with the genetic disorder have early closure of both coronal sutures at the top and front of the skull. This is where the need for surgery comes in. The race that has been reported of being affected by the most with Apert syndrome are the Asian race individuals. Most of these children are not officially affected intellectually. However, some learning disabilities may be present. Most recommendations are for the children to get involved with a speech therapist. Sometimes being born with the condition can cause a much higher risk of speech and language issues. The idea is to detect the genetic disease before birth. The diagnosis is usually detected during prenatal stages. It's a procedure given or available by amniocentesis. This also comes with a specific testing of the FGFR2 gene. Mental retardation has been proven to be more effective and be more normal in individuals with the syndrome. Another name for Apert syndrome is also known as acrocephalosyndactyly, which is basically the same disorder that causes fusion of the skull, feet, bones, and hands. Most people can experience social stigma and discrimination just due to their visible differences. Most of these individuals are at risk for bullying, social exclusion, teasing, and negative reactions such as staring. Most individuals experience some type of rejection with this genetic disorder. This sometimes can impact individuals. It can impact their mental stability and sometimes their quality of living. This condition can lead to depression, anxiety, and low self-esteem. Most individuals experience at least one mental diagnosis. Most parents who have a child with a disorder usually face some social challenges. Then the social challenges that parents face are like difficulties with acceptance. They might even deal with the negativity and social stigma because of the way the child looks. They may have feelings of low self-esteem. Then the craniosynostosis, that affects the development of the brain and causes intellectual development. Most misconceptions are that individuals with Apert syndrome are intellectually disabled. In addition, stigma with Apert syndrome comes from differences about intelligence. The key aspects of health for Apert syndrome contain surgical interventions. Surgical interventions such as mid-face advancements, hand and foot surgery, and craniosynostosis repair. This contains multiple supportive therapies. Things that support this are dental care, psychological support, vision and hearing care, and physical or occupational therapy. Diagnosing the condition early can sometimes be crucial for individuals to improve the quality of life. But now early diagnosed individuals usually deal with hearing loss, sleep apnea, infections, and sometimes even breathing difficulties. Most individuals just require ongoing care and monitoring by a team care member, or they emerge issues and manage the well-being of the individual with the syndrome. The discrimination and prejudice act due to appearance may sometimes just lead to isolation and loneliness. In dealing with the syndrome, addressing socioeconomic factors usually is one of the most important factors and most important things. The government has now provided things such as early intervention programs, support groups, counseling, specialized educational support, vocational training and employment assistance, and financial assistance programs. This provides intervention programs to develop and address potential learning disabilities. Most support groups and counseling groups that provide valuable resources, emotional support, just gives each individual a chance to share their experiences with having the syndrome. Specialized educational support usually helps assist with educational planning and it assists in technologies that can help students who have Apert syndrome. Thank you.